Thank you, Mary. I'm going to try to avoid any feedback here, so maybe if I step down one, it will be better. First of all, thank you very much for opening up the park to me today to be able to come out and address you. We're going to talk about healthcare today. I think that's why you're all here. Obviously, there's a lot of concerns, there's a lot of passion, and hopefully there's a lot of very constructive things that will be said today. I want to just start off by asking you to be respectful of each other. I've had numerous town hall meetings throughout the district, and I keep commending the people of the 3rd District of Pennsylvania, because everyone I've had has been very civil. People have been very respectful. We've been able to have a good discussion. And I agree with Mayor Lucas that this is our government at work, and this is what we should be doing. When the health care bill was first brought out, this is it. I always like to tell people, there's always this question, have you read the bill? And so I have read the bill, and I always like to show people it's 1,000 pages, but I don't know how far back you can see, but the bill, it's double-spaced, and it's pretty large print. So it's really not that hard to read, 1,000 pages, and if I couldn't read 1,000 pages, then I probably shouldn't be your congresswoman. But anyway, so one of the things, though, when this bill came out on July 14th, there was many of us in Congress who were extremely concerned about voting for the bill in July. And we really, really pushed to not vote for it in July for a couple of reasons. First of all, I mean, I could have read this bill between July 14th and the last day of July when we finished up our session, but to truly understand it and to understand all the different parts of it, I wanted to continue to be able to read it, reread it, reference some other things and go back and forth, and that takes a little while to do that. But secondly, and I think most importantly, is I wanted to have the opportunity for meetings like this. I wanted to have the time to come out and talk to my constituents throughout the 3rd District to get your thoughts, your ideas. If you think there's better ways that we should do things, and I want to hear that, because I think people have good ideas out there. And as I campaigned last year for this position, everywhere I went, people talked to me about the need for health care reform. A lot of people have insurance that they like right now, but a lot of people are worried about the future if you have insurance today. But there are many, many people in this district and in this country who don't have any insurance. And the people who are not covered by insurance, for the most part, are hard-working individuals who just happen to work for someone who, for various reasons, does not offer any kind of employer-based health care. Also, many people are underinsured. And I'm sure many of you have been in this situation where you maybe didn't pay anything for your health insurance for a long time. Then you started having to pay for a certain portion of your premium, and then maybe your deductibles have gone up. So now, instead of going in the hospital and having your entire hospitalization covered, now you might have to contribute up to $500 or $1,000 or even $5,000 or even more. So besides the uninsured, we have many who I would put in the category of underinsured. And then there is the stability and security part of this. You may have good insurance today and you may really like it, but next year, your business could decide, particularly if it's a small business, that we can no longer afford to pay the premiums. And they may decide to tell you that we're not covering you any longer. It's not a benefit we're offering. And that's a huge concern for many, many people. Or you may be in the category of the person who, maybe you're not really satisfied where you're at in terms of your job, and you see better opportunities at another company, but that company doesn't offer coverage, and your company does. So you have to stay in the job you're at because of that. Or maybe you have diabetes, or maybe you have heart disease, or maybe you have a history of cancer, and you want to switch jobs. But when you switch jobs, you're going to be switching insurance plans, and that company may very well say, well, now you have a pre-existing condition, and we're not going to cover you. So those kind of things really, I think, hamper our economic growth in this country. So as I was running and I was talking to people throughout this district, there was kind of this reoccurring theme that we have got to make reforms in our healthcare system. And everyone else pretty much heard the same thing, and so this has been an issue that I believe, we've been talking about for a long time. Obviously, we were talking about it in the early 90s, but we were talking about it even before then. And it's been political football that I think has been kicked down the road way too long. So how do we move forward here? And that's where the passion, I guess, comes in. You know, this is the bill that we have in the House, H.R. 3200. This has gone through 3 committees in the House. I have not had a chance to vote on anything, because I know last weekend somebody said, well, you already voted on it. I said, no, I haven't voted on anything. I'm not on those 3 committees, so I haven't had a chance to do that yet. Those 3 committees have to come together and come out with one bill that's going to then come in front of all of us in the House. And then there's going to be a debate on the floor, and there'll be amendments, and there'll be changes to the bill before anything is ever voted out of the House. The Senate basically is doing the same thing. They've got 2 different committees, and they'll have 2 different bills, and those bills will come out, and they'll put them together, and we'll have one bill. They'll debate it on the floor. And then eventually, those 2 bills from the House and from the Senate come together in a conference committee, and then they find where give and take happens, and what is kept in from some bill and taken out from the other. So then eventually, it would come back to both houses. Something would be voted on. That's what would go to the president, and that's what would be signed by the president into law. So that is the process. We still have a long way to go before any kind of health care reform is passed, but I do believe that when I go back in September, we will be going right back into the health care debate. So before I get into the questions, I just wanted to kind of lay out a few things, but I have on my website, which is dahlkemper.house.gov, or you can just Google Kathy Dahlkemper, and you'll be able to find my website pretty quickly. I have a health care reform survey on there. I've had well over 800 responses to that so far. It's electronic. You can do it right online. If you don't have a computer, you can certainly go to the library and do it, or ask your friend or neighbor to download it for you and get a hard copy that you can fill out and mail to my office. Or you can always call my office and we will mail you one. And I'm trying to get as many of them as I can, as many of you as I can, to fill the survey out, because I think the more people I hear from, the better I'll understand, where the people of the 3rd District are on this issue. As I said, this is one bill out of the House, and this is the bill I know. I don't know the bills coming out of the Senate. I have some general idea of what's in those bills, but I don't really know them. I haven't read them. And so when I talk about what's in the bill, it's this bill out of the House that I'm referring to. I do want to just address a couple of issues that I hopefully we can get into some other questions, but the first one I want to address in terms of I just want to give you the facts and not the fiction, have to do with end-of-life issues. And there's been a lot of news media coverage that somehow this bill promotes euthanasia. And I'm here to tell you, I've read the bill, it does not in any way promote euthanasia. I'm a pro-life person, I'm a whole life person, is the way I like to look at it. I believe in the sanctity of life throughout the whole continuum, and I would never vote for a bill that promotes euthanasia. I currently have 83 and 85-year-old parents, both struggling, very sick, and I would never ever vote for a bill that would decide that my mom and dad should not receive any further care. So I'm telling you that it's not in the bill. What the bill has in here is a clause or an ability for you or your parent or your child or anyone in your family to sit down and talk with your doctor about end-of-life issues and what you want. So it puts you in control, and it allows your doctor to get it reimbursed. Right now, your physician doesn't get reimbursed for this. If your physician talks with you about this, they have to have you in there for some other reason. You got to have your blood pressure checked, or you got to go in for your, whatever it is, cancer treatment. And then they might have time to sit down and talk with you. But this actually allows your doctor to say, you want to call your doctor and say, I just want to have an appointment to talk about these issues because I want to make sure that my family doesn't have to make that decision when the time comes as to whether I have certain treatments done or not. And you can decide you want to have everything done, and that's fine. You can say, try to save me till the last final moment, and your doctor can do everything, and there's no restriction on that. So I just want to make that